Assalamu alaikum. How are you, Abira? Alright, so beta, today we will be covering learning outcome number 3, assessment criteria 3.3. So, learning outcome number 3 is understand the monitoring and review of health and safety in health and social care workplace. This is the basic learning outcome, wording of learning outcome, and we have covered most of the part of this learning outcome. Assessment criteria 3.3 is evaluate our own contributions to placing the health and safety needs of individuals at the center of practice. So today we will be discussing the individual role or role of a person, whether he is working in that institution or he is just visiting the health and safety workplace for some purpose. Okay, so what would be the contribution of an individual person present in any health and social care workplace? All right, objectives will be to make you understand, able to state the individual contributions to placing the health and safety needs of individuals at the center of practice. How you can make yourself understand the importance of your own responsibility or your own contribution towards health and safety care workplace at the center of practice. Okay, so what should be your role, what should be your responsibility and contribution when we talk about individuals responsibility? Okay, let us have a brief introduction of today's topic. Placing the health and safety needs of individuals at the center of practice is crucial for professionals working in health and social care. This evaluation aims to assess the personal contributions in ensuring the well-being of individuals by understanding the limits of one's responsibility, taking ownership, ensuring personal and others' health and safety in accordance with organizational policies and procedures, and reporting potential hazards and identified issues. So let us see the importance of these contributions and their impact on promoting a safe and supportive environment for individuals. Okay. As we all know, we have already studied that how important is the health and safety thing, or you can say how important is to maintain the health of employees as well as the customers, or you can say the patients. How important is the health and their safety is. Now today we will be evaluating personal contribution, or you can say individual contribution towards maintenance of health and safety of everyone in that institution. Okay, now it encircles responsibility of a person, the ownership of that person, ensuring personal and others' health as well. Okay, so all of these things, they come in the similar circle when we talk about the health and safety protocols in any organization. Understanding the limits of own responsibility. What should be the limits of a person's responsibility or individual's responsibility in maintaining the health and safety? To effectively place the health and safety needs of individuals at the center of practice, it is essential to understand the limits of one's responsibility. Okay, when we talk about the center of practice, means the main aim, the basic or main objective of any practice or any procedure or any process. The first thing that should taken and that should be given priority, or that should be the basic thing to start any procedure or any process is health, ensuring health and ensuring safety of the person, and to know what are the limits. Beyond those limits, beyond those boundaries, no one should go ahead. Now, what would be the boundaries? There should be a limitations related to the use of instrument present in the labs of that organization. There should be limit to usage of instrument related to their machinery they're working. Okay, so there should not be consequences of heating up of the instruments. So there should be a limit of usage of any instrument. There should be a limit of showing carelessness to a limit, to a point. And beyond that point, everyone should take into account that care is personal care, and care of other colleagues is very important when we talk about maintenance of health and safety, or when we talk about the boundaries of limits of one's responsibility. Professionals should have a clear understanding of their role, scope of practice, and the specific duties they are accountable for. Okay, so first of all, before anything, we are talking about the employees of that institution. So all the employees and professionals of that institution should know what is their role, what is their responsibility, how their practice should be taken into account when we talk about the maintenance of health, and the specific duties they are accountable for. Okay, so what are the duties, what are the jobs that they are accountable for in case of any emergency or in case of any incident. Key aspects to consider include: number one, knowledge of regulations and guidelines. Evaluate the level of knowledge and understanding of relevant health and safety regulations, industry standards, and organizational policies. This includes awareness of legal frameworks, codes of uh, conduct, and professional guidelines. Okay, so knowledge related to uh, health and safety regulations, okay, industry standards, and organizational policies. These three things are very important. Knowledge, every person, every professional should be trained enough or should be educated enough to have the knowledge related to the health and safety regulations, so rules, the industry standards, and the organizational policy. Okay, why should everyone have the knowledge related to industry standards? Because the labs are the prime areas, the basic areas where there are chances of the spreading of infections, chances of spreading of many fatal diseases, and most of the health and safety protocols that are usually spoiled are always they happen in most of the time they happen in industrial area or lab area. Okay, so every professional, whether he or she is related or not related to the laboratory area, but he or she should have must have the knowledge related to the lab's protocol. And health and safety regulation is, of course, a common thing that everyone should have enough knowledge related to. And the final one is organizational policies. Whenever the chairman, the boss, the manager, or CEO of the organization devise any policy or any regulation, he makes sure that every person working in that organization should know what are the official policies, what are the official regulations related to maintenance of health and safety in that organization. This includes awareness of legal frameworks, codes of conduct, and professional guidelines. Okay, so legal framework is something that is not only related to the policies of the organization, but also it is related to the uh, basic, or you can say actual rules and regulations of the country or the community in which that organization is present. Codes of conduct, of course, it is very important in maintenance of a friendly environment in any organization. And then comes the professional guidelines. Okay, by professional guidelines means that your professionals working in your organization are not only educated but trained enough to have knowledge of every legal law, every regulation, or every legislation. Okay, so knowledge of regulations and guidelines is very important to deliver to every professional working in that organization. Collaboration and communication. Assess the ability to collaborate and communicate effectively with other professionals and stakeholders to ensure that health and safety responsibilities are appropriately delegated and coordinated. Okay. The code of conduct also involves collaboration and communication from very basic level to a CEO level. Okay. Communication should be smooth enough. There should be proper communication through all levels of command, all chains of command. So everyone should be able enough to collaborate and communicate with each other or with his colleagues or other professionals and stakeholders in order to ensure that health and safety responsibilities are properly coordinated among them. Okay. So first one is knowledge of regulations and guidelines, and second is collaboration and communication. Now, after understanding the limits of own responsibility comes taking responsibility. When one, when a person or an individual is aware of that what are his responsibility, what are the limits of his responsibility, then he must start taking his responsibility officially. Taking personal responsibility is a paramount in placing the health and safety needs of individuals at the center of practice. Professionals should actively engage in practices that promote a safe environment and prioritize the well being of individuals. Key aspects to consider include self awareness and adherence to protocols. Okay, so after knowing the limitations or the boundaries, the important thing that comes is to take the responsibility officially or professionally. So it is a very important thing in implementation of any kind of rule or regulations related to health and safety of the individuals. Okay, so professionals or the employees of that institution should actively participate in promoting a safe environment within an organization. Okay, so because promotion of a safe environment always ensures the well-being of the individuals, the customers, the patients, even the employees themselves in that organization. So the main key points that comes under the heading of taking responsibility is self-awareness and adherence to protocols. Now let us see one by one. Self-awareness. Reflect on personal attitudes, behaviors, and the practices related to health and safety. Okay, so self-awareness means that every person's behavior and attitude is also accountable in relation to the maintenance of health and safety. Okay, everyone should work in that institution with a positive attitude, with a proper behavior, proper code of conduct, uh, impressive communication style. Okay, so self awareness is very important. Evaluate the ability to recognize the potential hazards and risks and take proactive measures to mitigate. Not only the attitude and behaviors are important, but also the ability of those individuals to recognize, to sort out the potential hazards and the risks in that area. And furthermore, they should be able enough to resolve the issues, to correct the risk or to correct the hazards. It is very important. So it means that self-awareness related to the maintenance of or management of health and safety in any organization include from behavior, attitude, and even the ability of that person related to the hazards and risk occurrence in any institution. Number second, adherence to protocols. Assess the commitment to following organizational policies and procedures related to health and safety. This includes adherence to infection control protocols, proper use of PPE, personal protective equipment, and compliance with safe work practices. Okay, so after the personal attitude and behavior and the abilities, now comes the adherence to protocols. A person should be the man of words. He should make himself committed to the organizational policies, okay, like infection control protocols, proper use of personal protective equipment. It is basically the you can say a dress, safety dress, usually worn in case of spreading of any pandemic or endemic. Okay, so usually, but most of the time in most of the hospital, usually the PPE is worn by almost every physician or every professional. So protocols should be uh, seen, should be followed in case of emergency, and in either cases, if it is not emergency, then the protocol should be followed in normal days, routine work. Okay, so everyone, every professional should be committed to the organizational policies and procedures related to health and safety of his own self as well as his colleagues and the patients of that hospital. Ensuring own and others' health and safety. Promoting a safe and supportive environment requires ensuring personal and others' health and safety in accordance with the organizational policies and procedures. Okay, so promotion of a safe and supportive environment also requires personal as well as others' health and safety and related to the organizational policies and procedures. This involves creating a culture of accountability and taking necessary precautions to prevent harm. Accountability is very important. When we talk about the performance of the institution or organization, the growth of organization, or the performance of its workers or employees, accountability is very necessary. That is why the visits, official visits, usually they are known as by the name of inspections and audits. Okay, that is why audits and inspections are done, so that every organization and the workers working over there, they can be judged that to which extent they are working professionally, they are working efficiently. Key aspects to consider include risk assessment and management, promoting a culture of safety. Okay, so what is risk assessment and management? Let us see. Evaluate the ability to conduct thorough risk assessments and implement appropriate risk management strategies. This includes identifying potential hazards, implementing control measures, and providing necessary training and support to individuals and colleagues. Okay, risk assessment and management. We have studied this topic in detail in the earlier lectures, and I hope so you know very well that what is risk assessment and what is the management of risk assessment. So how the risks can be sorted out in or identified in the weaker areas, and how they are usually managed. This is the important thing. This is one of the important thing when we talk about the inspections and audits. And it is very important when we talk about the maintenance of health and safety of in an organization. Okay, so identifying the basic hazards, the main hazards or risks, implementing the control measures, okay, precautions you can say, and providing the necessary training and support to the individuals and colleagues. All of these things are very important in the management of any risk or any hazard. Promoting a culture of safety. Assess the contribution to promoting a culture where health and safety are prioritized. This involves actively engaging in safety initiatives, providing education and guidance to the individuals, and promoting awareness of health and safety practices. Promoting a culture of safety. Of course, actually, this is a trendy thing. When we want to promote anything, when we want to implement anything in our society, we start promoting that process, we start promoting that thing or that procedure. Okay, so if we want to maintain health and safety in our organization, that we cannot do anything alone. There should be a teamwork, a community work basically. So what we do, we will start promoting the positive effects or the benefits of maintenance of health and safety. Okay, so for that purpose, we need to involve the customers too in this process, in the promotion of health and safety. Okay, so everyone, if we talk about the individual responsibilities, everyone should contribute in promotion of a healthy and safe culture, and it involves engaging the safety initiatives, providing the education to the people, the guidance to the individuals, and promoting the awareness of health and safety practices among the common people, the layman people, the community people. Okay, so risk assessment and promotion of a safe culture. These two things comes in context when we are well aware of our own limits, when we start taking our own responsibility, when we become serious related to the maintenance of health in our community. Okay. So after these two responsibilities, then comes the risk assessment and management and the promotion of a safe and healthy culture. So everyone present in that community should play his role or play her role and in maintaining a healthy, disease free, infection free culture environment. It is not only important for us, but also, of course, for our elder people, our elders, and for our younger, for the young people present in our families. Now comes reporting potential hazards and identified issues. Identifying and reporting potential hazards and identified issues is vital for maintaining a safe environment and protecting the well-being of individuals. Professionals should actively report concerns and collaborate with relevant stakeholders to address them promptly. Okay, so identifying and reporting potential hazards. Now we have studied well about, we are trained enough to sort out, to identify any risk or hazard present in our organization. Now, the next thing after identification of a risk is reporting that potential hazard or reporting that potential risk and the related issues. Because this thing is also necessary. Just identification of a risk is not sufficient for maintenance of health and safety in any institution. Of course, there should be a solution to that problem. There should be a proper reporting system by following which we can solve a number of hazards if present in our community. Identifying and reporting potential hazards and identified issues is vital for maintaining a safe environment and promoting the well-being of individuals. Okay, because why? Because when we are correcting the risk present in our community, sorry, in our institution, we are basically making the environment of institution germ-free, hazard-free, disease-free, very safe, very healthy. So this way, we are ensuring the well-being of individuals who are visiting our institution. Professionals should actively report concerns and collaborate with the relevant stakeholders to address them promptly. Okay, so the professionals who are basically involved in sorting out the problems, the hazards present in the organization, they should collaborate with the stakeholders, they should collaborate with the higher authorities of the institution. They should inform them, they should report them the potential hazard so that the whole team of stakeholders of the institution should collaborate and sort out that risk or hazard. Key aspects to consider include observational skills and effective reporting mechanisms. Okay, what are the observational skills? Evaluate the ability to identify potential hazards and issues through regular observations and assessments. Observational skills. Okay, in order to have, in order to sort out or identify the hazards or risks, The professionals or the persons should be able enough to identify those risks, those hazards. Okay, and they should be able enough to sort out, identify that there is some kind of risk or there is some kind of hazard, and then they report this hazard to the higher authorities. This includes recognizing signs of neglect, environmental risk, or inadequate safety measures. Okay, now the identification of risk does not only involve that we have just sorted out that this problem is present in this area. For example, we will not only sort out that thermometers present in ITC are not working well. We should be able enough to sort out that why the thermometers are not working in ITC, whether it is due to the negligence of the nursing staff working over there, whether it is due to the temperature fluctuations in the ward, ITC ward, or whether no one is taking uh, care of the instruments present in ITC. Okay, so this is called identification of hazard. We will not only sort out, we will not only point out that this hazard is present, this risk is present in the weaker area. We will be able enough to sort out that why this risk is present, what is the reason of occurrence of the hazard. Okay, so these skills, these observational skills should be present in a person. Effective reporting mechanisms assess the knowledge and utilization of reporting channels and procedures within the organization. This includes promptly reporting hazards, incidents, or near misses to the appropriate authorities and actively participating in incident investigations. Okay? Effective reporting mechanisms, they should be present in almost every institution, and every person, every professional should be trained enough to follow these channels, to follow these mechanisms. He should know that how to report the hazard immediately. Okay, how to report the incidents or near misses that happen immediately to the higher authorities. How he can play his part in reporting any kind of hazard present in the institution. Conclusion. Okay, so beta, these were the main points, main responsibilities that everyone should follow or should contribute to maintain the health and safety in any organization. Whether we talk about knowing the limits of responsibilities, taking responsibilities, then comes ensuring on own and others' health and safety, reporting the potential hazards and identified issues. Now comes the conclusion. Placing the health and safety needs of individuals at the center of practice requires personal contributions that go beyond mere compliance with regulations. Okay, so when we have discussed it all in detail that when we talk about the health and safety needs of any individual at the center of practice, it does not only involve the personal contributions, but also not only the contributions, but also the awareness of the professionals related to the limit of their responsibilities, how it is important to take their responsibilities professionally, how they can ensure their own health as well as the health of their colleagues. Okay, so all these things are very important. This evaluation highlighted the importance of understanding the limits of one's responsibility, taking personal ownership, ensuring personal and others' health and safety in accordance with organizational policies and procedures, and reporting the potential hazards and identified issues. Okay, so we have discussed all these points earlier. By actively engaging in these practices, professionals can create a safe and supportive environment that prioritizes the well being of individuals and fosters a culture of health and safety in health and social care sector. So, by following all the protocols involved in maintaining the health and safety in any organization, we should be able enough to maintain a safe environment. Okay, by ensuring not only our own health but also ensuring our colleagues' health, our colleagues' safety. Okay, we will be able to promote a safe culture in the organization. Okay, so this was all about today's class, that is assessment criteria number 3.3, which states that understand the monitoring and review of health and safety in the health and social care workplace. Sorry, this is learning outcome number 3. So I hope, Subita, everything is clear to you. If you have any question or any confusion regarding today's class, you may ask, please. Okay, I hope so. Every point is clear to you. Okay, can you tell me only one contribution of an individual towards maintenance of health and safety in any organization? Contribution to maintenance of health and safety in any organization. The one responsibility of any person. Yes, reporting potential hazards. Good. And what is the basic responsibility? Potential hazard basically comes after 2 to 3 responsibility. What is the basic responsibility? Ownership, yes, by knowing the limits of a person's responsibility, to which extent a person is involved. Okay, good. Okay, better. So this was yes. Okay, in relation to organizational policies, yes. Okay, so beta, this was all about you today's class. That is lecture number 12. Inshallah, hope to see you in next class. And till then, if you face any problem related to your tasks, task number 1 and 2, to tell me, okay? Inshallah, I'll respond you at yeah at on time, hopefully. Okay, beta. Thank you so much. Allah Hafiz.